all the listeners of Health Education Lecture Series. I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. Uh, as you know, yesterday we could not deliver English lecture for the regular systematic program of life from life, how the life is created from life. So we have to deliver first of all this English lecture today regarding the life from life. And we are at the stage of fetal abnormalities. There are some fetal abnormalities left remains during mother's womb. And those abnormalities sometimes are not covered in due course of 280 days. And then those comes up even after the birth of a child and even up to a longer life. Some of the problems go lifelong with the persons. So these abnormalities we are discussing one by one. And we have already discussed the heart problems, which are known as congenital heart troubles, and the same way the problems in the brain, same way the problems. The most important things we are discussing here, because if we start discussing only the brain, it will take months to us. Which are the most important, most prominent things which comes up when a child is born and we see the abnormalities, those we are discussing. And here we are at the point that we are discussing fetal abnormalities, and the subject which we have discussed yesterday in Hindi and in Punjabi program, that was you can say the deformities, Down syndrome. Down syndrome. When you say Down syndrome, it means something is down. Something is not according to the norm. So that is known as Down syndrome. Okay. So Down syndrome overall is not concerned only with one or a few systems of the body for the developing fetus, but it is concerned with all the systems of the body. As a whole, it affects, because this Down syndrome is because of the genetic problems. And genetic problems we have discussed that it is known as trisomy. We normally know about that when sperm and ovum meets together, and they have 23 pairs of chromosomes, 23 pairs of chromosomes, and these 23 pairs of chromosomes has 22 chromosomes which do not have any active part for the formation of the new generations, and just they are known as the body chromosomes. And then there are one pair in male and one pair in female. In female, it is known as XX, and in male, it is known as X and Y chromosomes. These are the character building chromosomes. Character building means they carry the characteristics of the previous forefathers, which are shown, represented in the newborns. In this conditions, in this condition, if it's indirectly we can say that if some problems are in the previous generations, those generations can show up in the newborn. And sometimes there are some incidences when parents, current parents means mother and father, who are joining at this time, they are healthy otherwise. They do not show any this type of Down syndrome in their life history, but they were having a hidden conditions of the Down syndromes of the trisomy genes. trisomy genes when these XX or XY in male and female fuses with each other, and a third genes come up, third chromosome comes up in this picture, and when they multiply, ultimately it comes up repeatedly, and in all the cells sometimes, and sometimes in the few cells. That shows its characteristics of deficiency. If it shows in all the cells when they multiply further for the development of the body, for each and every cell of the body, that is known as trisomy. But sometimes these are not shown in all the cells. In few of the cells, this trisomy type of condition is shown, that is known as mosaic, mosaic trisomy and type of things. Means some of the functions of the newborn baby or baby in the mother's womb will show abnormalities in its development, but other systems are showing the normal patterns of development. In this way, these type of conditions of Down syndromes are of different categories. If it is partial, then it may show up in some of the systems of the body. But if it is generalized, this characteristic may be shown by all the systems of the body. And in that way, if a person is having trisomy virus in its, you can say, yeah, in its genes, then a picture will come up of the deficiency in the newborn babies. And even nowadays, we are able to detect these deficiencies after 15th weeks of pregnancy. Means after 4.5 months of the pregnancy, we are able to detect these type of things, that the baby in the mother's womb is not developing normally. And if it's not developing normally, by the ultrasound, by the measurement of the abdominal girth, development of the fundus of the uterus in the abdomen, all these things indicates that the development is not according to the normal pattern of the pregnancy, and also the fetal development inside the mother's womb. So in this way, sometimes if it's serious things, doctors suggest that your child is a problem for you, as well as it will be a problem for lifelong for you. It's better, it's better to get it aborted. Means medical termination of pregnancy on the advices of the doctors. But in case if we do not have any means to diagnose, in case if the family desires to give birth to the child in whatever way, they need some newborn baby in their family in whatever way, then under those conditions, when those child's born, they show deficiencies in their body developments. And this deficiency is not only in the body development, it's also in the mental faculties as well, mental deficiencies as well. So now, as we said, cause we have already declared. The cause of this one is the trisomy genes. Cause of this one is double copy of the genes formation. Gene has been formed by XX, gene has been formed by X or Y, and this is multiplying. But if there is a when they fuses with each other, sperm and ovum fuses with each other, and some parents is having, in spite of one XX, it has XX, or one male boy getting characteristics from the father, it has X and Y, and then it has a double Y. So ultimately, the mixture of this one will continue to multiply further for the development of the body structures. And when the defective copy of the chromosomes will multiply, it will show up defective that defectness, deficiency in all the cells of the body. And if it shows all the cells of the body, first of all, we will discuss in the structural changes. What are the structural formation changes in a child who is having trisomy genes inherited from the parents? But one thing before going forward, before giving you the sign and symptoms of this kind of conditions, I would like to tell you, always it is not that it is inherited. Always it is not that it is inherited, means acquired from the parents. No, it may be acquired himself by some type of conditions, just like I told you previously in previous lectures, that some type of characteristics develops in those children which are born to a mother after 35 years of age. Means the first pregnancy has taken place after 30 or 35 years of age. As the mother grows older in age and get pregnant later, her child may have, there are more chances that her child will have more deficiencies of this kind of things, which is diagnosed as Down syndrome. But one other thing, it is not always the case that if a mother has a first child with trisomy conditions, means with Down syndrome conditions, all the children of that mother or all the children of those parents will have the same thing. No, not at all. It is not possible. It's not the conditions. Other children may be healthy, normal in their go of life, but one of them or more than one may have this type of characteristics, especially if it is coming from the inherited genes from the mother or parents. There are chances that more than one child may be down of some Down syndromes. But when it is acquired because of the deficiencies and problems at that time from the sperm and ovum and their fusion with each other, and the condition at that time when they were fusing, then it is known as acquired Down syndrome. And in these conditions, it is not possible that all other his siblings will be having the same problems. No, they will not having the same problems. So this is ruled out, that we should not worry about this thing, that if one child of a parent is having Down syndrome, all his children will be having deficiency or Down syndromes. Or it is not possible even that if it is inherited, that all children will have the same thing. If it is acquired, even then it is not necessary that other siblings will have the same deficiencies, because every incidence, whatever happened, is because of some action. Means if it is not acquired, not genetic from the coming from the parents, means it has happened when the new life has started, has begun with the fusion of sperm and ovum. Means it is our own fault. Environments, diet, and all these things which are affecting the mentally and physically, and also all these physiological function in the developing baby in the mother's womb, they can create this type of conditions, deficiencies. So deficiencies may be partial in some organs, deficiency may be in all the organs, and those conditions we have already told you: trisomy or the mosaic type of deficiencies, or Down syndrome. After that, uh, I recommended all the times that every parents should make sure that their first pregnancy should be before 25th years of age, means delivery. Basically, they should deliver a child or should get pregnant before 25th years of age, because after that there are definite changes in the epiphysis union of the bones and the pelvic structures of the female. Then there are chances that some type of deficiencies may remain, or even during the birth of the child something may happen. To avoid all those things, pregnancy should be before 25th years of age, and if it is later than that, then there are chances that her child will be having Down syndrome phenomena. So in this way, causative factor is directly go to the genetics, maybe acquired problem created during the start of the new life in the mother's womb, or it may be genetically acquired from the previous forefathers or parents. And parents may not have any sign and symptoms of this one, but their child may have because of the acquired conditions. And sometimes the parents has one or the both. Parents are having this trisomy type of conditions, but it is not necessary that their children will have the trisomy conditions in their body developments. So in this way, these are the causes which are mainly concerned with this one. After that, how you can judge it, how a general public can know about that a person is having trisomy type of syndromes or Down syndrome. That is a big term used for this one, is the Down syndromes. So Down syndrome symptoms and signs which we see in a already born child, or in already born in adult conditions, which they were still surviving with the Down syndrome conditions, means a child or an adult which is having an inherited type of a condition of Down syndrome, how the deficiencies of the structural formation of the body will be shown in his body, and even the mental state will show the signs and symptoms or deficiencies of the Down syndrome in mental faculties. So, first of all, if we see the head of a person, head of a child who is a Down syndrome patient, who is having Down syndrome, in those conditions, his head will be smaller. Second, his neck will be smaller. It looks like the small ball is placed on the shoulders. Small ball is placed on the shoulders because neck is small, head is small, and it is on the shoulders. So ultimately, ears are small, and sometimes the ears are not leveled as they should be at the level of the eyes. They are not. Second, The visible sign, which we can see, the nose bridge is not prominent. Nose bridge is not prominent, and it is as if a flat nose. You can say the flat nose is there, and the flat nose covers most of the part of the face, and most of the part of the face is covered by the nose. And then in that conditions, there is a line created on the nose wings to the lips. There are multiple lines. Second, the velvety skin is shown from the medial canthus of the eye to go towards the cheeks. That's the zygomatic process. That shows also a deficiency sign. After that, eyes are directed mostly upward. And then, if you see inside the ball of the eye, you will see there are white spots on the cornea, not on the conjunctiva. The black portion is known as cornea, the white portion is known as conjunctiva, and there are white spots on the cornea. These are the conditions which are visible on, just you see in front, from the mouth, face, all that. Now come to the mouth. Teeth are smaller, and the tongue. He wants to protrude the tongue, but it is not protruded out of mouth. It is stuck with the upper mandibular teeth line. It is stuck with the mandibular teeth line, does not come out. So these are the important conditions which we see in a deficient in this Down syndrome patients of the face. So short neck, face chubby, flat nose, wrinkled face, spots in the eye, small ear. All these things are visible, which you can see that. And after that, the skin, overall skin of the body is folded as if a small object is covered by a big covering of clothes. Small body is covered by a big skin fold. Same way, a small body is covered by a big clothing. It shows wrinkle. So, in this way, the skin of the person with Down syndrome shows velvety, wrinkled type. In this way, folded skin is the important symptoms of this Down syndrome. Ear small, I have already told you. After that, hand and foot, they looks like normal, but their skin is still folded skin. And on palm side, it has only one divisions. We have multiple lines here, but they are mostly having one or only few lines. And the important thing with the hands is the fingers are smaller. As compared to the palm, fingers are smaller. The same way in the feet, you will see the feet are normal, but the fingertips, toes, you can say, the toes are smaller. So it will give a different, unacceptable look to the hands and also to the feet, that a person is a Down syndrome patient. This patient is having Down syndrome because small feet and finger, sorry, and toes, small fingers in the hand, whereas the palm has a folded skin on it. After that, normally, Down syndrome persons are not attain the full height as compared to their parents. They have small height, short height, you can say, dwarfism. The word is used here, dwarfism. So, in the case of dwarfism, the statue is small, height is small, but by body trunk as a whole, chest and abdomen is known as trunk. Trunk is a normal and with folded skin all around. After that, poor muscle tone. How you can recognize that poor muscle tone? The action of chewing, action of talking, all these things which are because of the muscles, action of hands is slowing down or is in a different direction from the normal constituents of the persons. Just like our arms could be folded in front, adding. It is known as addiction, adding. But if a person is having Down syndrome, his arms will move even to the back side to the opposite direction, which in general for all the persons is not possible. All the person cannot move their arms from elbow backward. They can just move it, they can just fold it in front. Same way, all the persons can fold their knee and leg into the backside. And if a person is having Down syndrome, their knee may be advanced or folded up to the opposite side. So these are some uh, definite type of changes, you can say, which are mostly without talking to him, you can judge that this person is having Down syndrome. And after this, mental things, poor intelligence, cannot make decision what to do, what not to do in the season, cannot recollect the thoughts, memory is weak. So all these things comes in the same phase. Now, the risk factor. What are the risk factor of this one is in the old age, the person, if the pregnancy occurs after 35 years of age and that child has developed up to 35 years and after that, or young persons, those persons may develop Alzheimer's, may develop Parkinson type of disease, and these type of persons who are basically patients of Down syndrome. So this is the main risk. Second, the problems of the heart. There are many more problem of the heart which are by birth and sometimes which are acquired later on also are the causes or features of this Down syndrome. And after that, abnormalities in the intestines. There are many type of abnormalities of creating enzymes to digest food and also the evacuation of stool, wastage through the intestines. For this all functions, these total functions are delayed. Complete formation of the intestine is presumed during the mother's wab time, means 280 days. But if it is not completed, the newborn child will not pass a stool because the union of the intestinal parts has not taken place. In the same way, phimosis. Phimosis is also a condition in the children those who are children of Down syndrome. Phimosis means a covering on the glans penis outside is stuck or united with each other. There is no opening of a urinary hole, and child cannot urinate. Sometimes, if he urinates, it bubble it comes up like a bubble in front of the urethra because there is no opening so that urine can go out, and child cries with that. These are in the beginning stage of this one when a child is born, and ultimately digestive system has GERD, acidity, which is normally in the old age peoples when the digestive system is not normal. First of all, it was normal. First of all, everything was normal. But now, when a person is of Down syndrome, their digestive system, even in the childhood, is not normal. It has gas formation, it has GERD, regurgitation, acidity, gas formation. All these things may be associated with that. And after that, sleep apnea or snoring, which are mostly the signs of old people's having digestive problems. Previously, they were healthy, normal, everything, but as they grow older, all the system, enzymes, and everything becomes slow. And because of the slowness of this thing, a gas is formed which goes upward in the stomach and the esophagus and upward to the mouth. That produces sleep apnea, snoring, acidity, acid reflux. All these things are coming up with that. So, in general, the complication for this thing is that the persons are overweight as compared to the age and the height. Age and height, they are not having the normal standard of the weight. They are more in weight, where increase, flabby, fluffy bodies with more age, small stature, small height, but more weight as compared to that. And then there are some other problems, spine problems, vertebral column problems, just like spina bifida, or there are other type of more problems we will discuss one by one. There are many more problems in the you could say vertebral column that persons with Down syndrome suffers from that one. In this way, life expectancy is up to 60 years. That's sufficient because in Indian culture, mostly people, mostly the average age is not 60 years of age. But in this condition, a person can survive 60 years of age. But it is not easy. It is not simple that they will lead a normal life, not at all. Mentally and physically, everywhere, they show the deficiencies. And these deficiencies make his life harder and harder at step. At every step of life, it makes harder and harder because they cannot cope up with the challenges of the age. What are the challenges? A child is school going age, and he is unable to understand, he is unable to recollect the thoughts, he is unable to answer, he is unable to decide anything, indecisive, all these things. And later on, when he becomes older, all other conditions which are associated with the adult age, they are not performed normally. And same way for the old age, when a person of this kind conditions, Down syndrome, become old person, under those conditions, all the systems are slow down more than normal in a person. So ultimately, everything everything shows like a sickness. stool passing, urine passing, talking, eating, digestions, everything is slowing down. So these are the normal conditions. I have told you about the Down syndrome, which we could not deliver yesterday because of the lecture in Punjabi and Hindi. So today we have completed these things. And next day we will start with the next chapter of abnormalities in the vertebral column, or we can start with the ADHD, or autism in the children. So we will start it tomorrow. Today we will stop this lecture here, and tomorrow we will try to cover up all the three lectures: English, Hindi, Punjabi. So tomorrow, as Radio Pravas joins us in the beginning time, so first lecture will be in Punjabi, the second lecture will be in Hindi, the third lecture will be in English. We will continue in this sequence series of lectures, abnormalities in the fetal life. मैं गुरदीप सिंह संधू homeopathy consultant. My clinic address is 7021 Village Parkway, Dublin, California 94568. My phone number is 408-687-1899. My email address is homeomedicine@yahoo.com. HOMEOMEDICINE@yahoo.com. Anytime you want to discuss with me, or you want to take a second opinion about your sickness, or you want to get treated with scientific homeopathic treatments, you can call me 408-687-1899. God bless you. We'll see you tomorrow.